All right. So welcome back. I had some technical issues earlier on, and just the videos that we showed earlier and the pictures that we just showed now. Um, Again, I love seeing the joy of the community, of the kids, of the adults, and they just light up our lives. And so, the last section of this conference today, we're going to be addressing some specific needs as it relates to the community. And so a lot of you will realize that I put a post in the Facebook group probably about 2 weeks ago now. And I really just want to know what the specific concerns and questions are. I think we've seen a lot of great conversations coming through the chat today, but I wanted to kind of aggregate totals of what are the main pain points or concerns of the community. And this next section, we're going to be reviewing a lot of that. We wanted to make sure that you know that your voice matters, your needs matter. And I'm excited to bring in Kira Dyes, who's the genetic counselor for the Kleefstra Syndrome Clinic at Boston Children's Hospital.
There we go. Can everyone see the slide? And here we, perfect. Hi there, thank you guys for attending today. As Jeff said, I am Kira, I'm a genetic counselor, and I will be helping to coordinate the setup of the multidisciplinary Kleefstra Syndrome Clinic at Boston Children's, relying on my experience in setting up a number of other rare disease clinics that are specialized at Children's. So as we said, this session will really focus on the family and patient concerns, and we'd like to have an open dialogue with some questions and with our expert panelists. So as clinicians and researchers, just hearing directly from you as patients and families about your needs really will help us in the development of our clinic, in knowing the specialties that we want to have involved, as well as help tailor our research priorities. So we are listening and wanting to learn, so we make sure we best meet your needs as well. So I'm going to start first with a question from Margot, because we note here the most cited concerns are by you all were regression, mental health, anxiety, behavior questions, sleep. We saw a lot of questions this morning in the chat about sleep, and then coordination of clinical care. So we're going to address that with a number of different questions. Medication and pharmacogenomic, as much as I'd love to discuss today, tends to become a bit individualized. So I think we'll defer questions on that. But we'll start with really talking about those top 3 concerns. I'm going to start with Margot, who is from Raleigh, North Carolina, as you know, and has an 8-year-old with Kleefstra syndrome. And she's going to start with our question, which I'm hoping either Sid or Joost or somebody will be able to answer.
Thanks, Kira. Hi, everybody. I'm Margot Metzger. I am the mother of Adelind. She's 8 and was diagnosed when she was 5. She is the light of my life. And I think to myself, well, she's only 8. And then I think to myself, oh, wow, she's really growing up fast. And so my questions are around regression. Firstly, do we know what percentage of individuals with KS experience regression? And I'm also interested in the timing of puberty in the population with Kleefstra syndrome. And just generally what I should be on the lookout for, how I can prepare, and what I should do if I notice something.
I think perhaps if Joost or Dr. Kleefstra is on, I think given their collection of data, I think they would be great to answer that question. And I don't know if they're available.
I can't see, I'm trying to change my screen to see the other panelists. I apologize, it doesn't appear. Joost or Dr. Kleefstra, are you guys on? Let me see if I can find you.
well, while you're searching, I guess I can start to answer. I think it's a really good question. And I think the first thing is collecting data to really better inform ourselves about what that prevalence is, because I think the short answer is probably that we are not entirely sure. We can certainly, and that's why I'd love to hear the experience from Joost or Dr. Kleefstra about their experience in their patients. But I think it's challenging because we don't, even if we know the percentage, what we still are struggling with, or what we still need to better understand is, well, for a specific individual with Kleefstra, for your child, what are your chances that your child may develop regression? What are the factors that predict regression in your child, whether it's level of functioning, whether it's genotype, whether it's sleep issues? I think those are equally valid questions. So I think ultimately, I think my kind of my perspective on it is that it's a really important question, but we still are at the very beginning of understanding the factors that play a role into those who develop regression, and being able to better kind of counsel families on what's their personal or individual risks for developing regression, what their child's individual risk percentage or whatnot for developing regression. I guess the second point you had raised is that, so I think the first, what to do if I think a key point is recognizing that this may be a possibility. And I think recognizing, regression within Kleefstra syndrome is often, often can be accompanied by significant sleep disturbances as kind of a herald or precursor to the loss of self-help skills. And so if there's a substantial change in sleep, in sleep patterns, that is just very different or very significant compared to prior sleep patterns, I think that could be something to be on the lookout for, and just start to kind of ask more questions and monitor more closely and find out, well, in addition to sleep issues, are there other features that are going on? Is there worsening behavior? Is there worsening mood states? Is there worsening, challenges, et cetera, and being on the lookout for those type of symptoms that can accompany the really significant sleep disturbance that occurs.
Do you have anything more to add?
Yes, thank you, Sid, for commenting on that. And I think that's oh, now I'm getting, yeah, that's perfectly fits what we would comment on. So that's exactly why we are studying this. We just don't know. We received through the past years, many alarming emails and messages all around the world from other clinicians that had individuals at their clinic with having these severe problems and asked our advice. And yeah, as this theme that we heard today several times, it's a rare disorder. The Netherlands is just a small country, and we only have a limited number of patients so far in our, well, longitudinal collection. And it's a bias, we only get in touch or people get reached out to us when there is problems in their individuals and their patients. And adult patients who do really well, we're not so likely to hear about. So that's why we should study this prospectively in a longitudinal course. And I hope in a few years we can better address such questions. We just don't know. That's the point. It happens, but to whom and why, and how can we help this to the best? We really need study for that. We're just at the start.
Thank you.
Okay, next I'm going to move to Susan Estelle, who's also a parent. Susan. Okay. Our technology may not be working as well as we hoped. Let me go to Matt and Maria Lockwood in case Because I saw Matt raise his hand there. Can we hear you, Matt?
Yeah, hi. Our 3-year-old daughter, Wynn, wakes up several times a night, which we think obviously affects her capabilities, but also it impacts our 6-year-old daughter and us as well. Could Dr. Sid or Dr. Kleefstra maybe gives recommendations on how it would be best to go about tackling this problem?
Sure, Dr. Kleefstra, if you want to get started, and then I can add.
Yeah, we often face sleep problems. So the sleep issues we discussed in the previous question are slightly, we think, slightly from a different angle. So these are kind of a precursor of the, well, deterioration or the psychiatric deterioration that happens. At the younger ages, it can have all kind of causes. So yeah, sometimes there's just somatic causes. Some children might have problems with their reflux, for example, when laying flat, and so or seizures, or especially at night. So there should be all kind of somatic aspects that first should be ruled out before saying it's well, more a behavioral aspect of the condition. And then there are several sleep interventions, so behavior intervention for sleep restriction program, or there's different approaches, and there's medication that could be tried, but it's very difficult to just in a general way approach sleep problems, because they are very common and might have very different causes. So the recommendation would be to really get this, yeah, studied individually for your child. What is happening for your child in the context that he or she is showing these problems.
And the only other things that I would add is that I think, absolutely, sleep issues are a huge challenge across many different neurodevelopmental and neurogenetic disorders. And just some general concepts, I think, for like Dr. Kleefstra mentioned, it's so many different factors at play, like reflux, appropriate sleep in, environment or sleep hygiene, right? So kids are very, very drawn to consistency. So if there are changes in bedtime from one day to another, that could be a contributing factor. Screen time can also be another cause for decreased difficulty with sleeping. Assuming not having a dark, room without any ambient noise, that could be another factor. Assuming there isn't like a sleep environment problem, or assuming there isn't kind of a behavioral issue that is at play, then we think about things like restless leg syndrome. Does your child move their legs around a lot? That can sometimes be related to impaired sleep difficulty or impaired sleep. Is there snoring, pauses of breathing that could suggest sleep apnea? And assuming there isn't a behavioral component, assuming there isn't a medical factor like we talked about, then after ruling these things out, then we think about medications. And the way we think about medications is whether it's a problem with sleep onset, meaning problem with falling asleep, or sleep maintenance, which is a problem with staying asleep. And there are different types of medications that help with sleep onset, such as melatonin or clonidine, versus medications that can help with sleep maintenance, such as trazodone and various other things. So it's multifaceted, and often it's peeling apart these multiple layers from the environment, from behaviors / consistent routine, from medical factors like reflux or restless leg syndrome and things like that, and apnea, and finally thinking about medications if all these other options haven't been fruitful in terms of helping sleep.
Thank you very much.
Thank you. All right, Sue, I'm sorry I couldn't see you before. There you are. Please ask your question.
I was wondering, where can I tell my local doctor to go to find KS information that will help him or her make an informed decision about my daughter's care, especially in a crisis when there's not a lot of time for research?
we see that as a real need. I'm gonna defer to one of the panelists, but I do want to let you know about our goals to develop some clinical consensus guidelines. So Dr. Kleefstra, I don't know if you want to elaborate on that.
Yeah, so that we are working on, that could be helpful for the clinicians that are involved. Where are you based?
In New Jersey, in the United States.
Okay, yeah. So clinical guidelines may be helpful, but you also need a dedicated professional that you can go to in your own local environment, especially when it comes to acute problems or crisis. So, not sure what's the age of your child?
She's 8.
Okay, yeah. So for the psychiatric issues, it's still young, but yeah. So you need a local team or professional that you can go to, and the clinical guidelines that we are developing that can be helpful for clinicians, even if they are not specialized in this syndrome. It's not needed to, but they need to be dedicated to people with neurodevelopmental disabilities.
Sometimes what we do for patients that don't live nearby, even internationally, is you can go to a specialized center once a year and sort of do your specialized care check-in, but then have your local physician. So, we have a program, Boston Children's. I believe there's a group at Johns Hopkins that's a little bit closer to you potentially. But that is really our goal, is to develop this network of clinics in the US and internationally. So it may not be in your state, but perhaps it's a place you could visit at least once yearly, and that your local doctors could be corresponding with those experts.
Thank you.
So we have a few minutes left. I did just monitoring the chat. I think there were a number of questions around fluid intake, and that children tend to are drinking a lot of water and constantly thirsty. I didn't know if that was something somebody could address on the panel.
Shall I start then? Yeah, so we incidentally have faced and seen this. Yeah, you also for this, like the sleep, you need to carefully study if there is any physical problem, any somatic problem that causes this, why the child is taking so much fluid. But alternatively, we also know that it can be more behavior driven. So behavior driven fluid intake, that it's, yeah. So can have many causes. Mm-hmm. But it's not that common as far as we know, but yeah, not sure if there's other experience in Boston.
Okay. There was also a question about visual problems that are often associated with Kleefstra syndrome.
Yeah, so that's very common, and it's mostly farsightedness, and it can be overlooked because the child will not tell you that he or she is not seeing it correctly or properly, but especially already at young age, that can be very helpful to have glasses for them for their farsightedness. So it's really recommended to have a vision check from early on.
Okay. Thank you. Anyone else? I don't see any additional questions with raised hands. We will next move to Jeff, unless there's anything else folks want to discuss in this segment.
I think many topics might come along in the Q&A session, isn't it?
And we have an expert panel coming up next.